Hello everyone, now let us discuss about anatomy of musculoskeletal system. In the current session, we will be focusing on the bones of forearm, ulna and radius. As we have said earlier, forearm is composed of two bones, ulna and radius. Ulna is located on the medial aspect of the forearm, that is towards the little finger side, and it is longer than radius. Whereas radius is located on the lateral aspect of the forearm, that is towards the thumb side. And radius is smaller bone of forearm. When compared to radius and ulna, ulna is longer than radius. Now here, first let us discuss about ulna. At the proximal end of the ulna is the oleocranial. This is the proximal end. This is ulna bone. This is the proximal end of the ulna. So the proximal end of the ulna is the oleocranial, which forms the prominence of the elbow. With oleocranial, an anterior projection called coronoid process. And here this you can see, this is the coronoid process. Articulates with trochea of the humerus. This coronoid process of the ulna, it articulates with the trochea of the humerus. Just inferior to coronoid process is the ulnar tuberosity. Just inferior to coronoid process is the ulnar tuberosity. Here you can see ulnar tuberosity, and to which biceps brachii muscle attaches. This is the point of attachment for muscle biceps brachii. And distal end of the ulna. Now you can see the distal end of the ulna consists of head. The proximal end of the ulna has oleocranial, whereas the distal end of the ulna has head, that is separated from the wrist by discofibrous joints. Now coming to styloid process. Styloid process is located on the posterior side of the ulna's distal end. On the posterior side of the ulna's distal end, you can see styloid process. Sorry, this one. On the posterior side of the ulna's distal end, you can see the styloid process of ulna. This is the styloid process of ulna. It provides attachment for ulnar collateral ligament to the wrist. Styloid process of ulna is the point of attachment for ulnar collateral ligament to the wrist. So these are some of the important anatomical components of the ulna. The first one is oleocranial, which is located at the proximal end of the ulna. And the next is the coronoid process. Coronoid process that articulates with the trochea of the humerus. And the next is ulnar tuberosity, which is the point of attachment for biceps brachii muscle. And the next is the distal end of the ulna. It is composed of head, that is separated from the wrist by discofibrocartilage. And next is the posterior side of the ulna's distal end is the styloid process of ulna. The styloid process of ulna is the point of attachment for ulnar collateral ligament to the wrist. Now coming to the anatomical components of radius. So distal end of the ulna has head, you have discussed earlier, whereas the proximal end of the radius, that is here, this is the proximal end of the radius, has a disc shaped head. Head of radius is at its proximal end, whereas head of ulna is at its distal end. So the proximal end of the radius has a disc-shaped head that articulates with the capitulum. This is the head of the radius. This articulates with the capitulum of the humerus and with the radial notch of ulna. Head of radius articulates with ulna at the radial notch of ulna, whereas it articulates with humerus at capitulum. Inferior to the head is the restricted neck. This is the neck of the radius here. This one. Here you can see. Inferior to the head is the constricted neck of the radius. And the roughened area inferior to neck is the radial tuberosity. The roughened area inferior to neck is this is the neck of the radius, and the roughened area inferior to neck is the radial tuberosity. This radial tuberosity is the point of attachment for tendons of biceps brachii muscle. Here tendons attached, tendons of biceps brachii muscle. And the next is the shaft of the radius. This is the shaft of the radius widens distally to form styloid process. The styloid process of the radius. Here you can see the styloid process of the radius, which provides point of attachment for brachioradialis muscle and radial collateral ligament to the wrist. So, styloid process of radius, it provides the point of attachment for brachioradialis muscle and the radial collateral ligament of the wrist. And finally, distal end of the radius, it articulates with the 3 bones of wrist. The distal end of the radius, it articulates with 1, 2, 3. 3 bones of the wrist to form wrist joint. So what are those 3 bones? They are lunate, scaphoid and triquetrum to form radiocarpal joint, which is nothing but the wrist joint. So wrist joint is formed by articulation between radius and 3 bones of the wrist, which are lunate, scaphoid and triquetrum. These are the various anatomical components of radius. The first one is the disc-shaped head. That disc-shaped head that articulates with the capitulum of the humerus and the radial notch of the ulna. The next is neck of the radius. The next is the radial tuberosity, which is the point of attachment for tendons of biceps brachii muscle. Next is the shaft. And next is the styloid process, which forms the point of attachment for brachioradialis muscle and radial collateral ligament to the wrist. Next is the distal end, which articulates with 3 bones of wrist, that is lunate, scaphoid and triquetrum to form radiocarpal joint or wrist joint. Now coming to the points of articulation of radius and ulna. Radius and ulna, they form or they join at 3 points. There are 3 points of articulation where radius and ulna join. The first one is the broad, flat, fibrous connective tissue called interosseous membrane that joins the shaft of 2 bones. Broad, flat, fibrous connective tissue called interosseous membrane. It joins the shaft of 2 bones. The next is point of attachment is proximally. Proximally, head of the radius articulates with ulna's radial notch, and this is called as proximal radio-ulnar joint. Distally, head of ulna articulates with ulnar notch of the radius, and this is called as radio-ulnar joint. So there are 3 points of articulations of radius and ulna. The first one is interosseous membrane, the next is proximal radio-ulnar joint, and the next is distal radio-ulnar joint. Now coming to elbow joint. Elbow joint is formed by articulation between 3 bones, ulna, radius and humerus. The ulna and the radius, they articulate with humerus at the elbow joint, and the elbow joint is formed by 2 points of articulation. The first one is head of the radius articulates with capitulum of the humerus, and the next is trocheal notch of ulna articulates with the trachea of the humerus. So these are the points of articulation for elbow joint. It is formed by 3 bones, and there are 2 points of articulation. The first one is head of the radius articulates with the capitulum of the humerus. The next is trocheal notch of the ulna articulates with the trachea of the humerus. Now let us discuss about elbow joint. What type of joint is that? Elbow is the hinge joint, which is nothing but a synovial joint that is formed by the trochlea and capitulum of the humerus, the trocheal notch of ulna and head of radius. Now coming to the various anatomical components of elbow joint. Elbow joint is composed of articular capsule, ulnar collateral ligament, radial collateral ligament and angular ligament of radius. These are the various anatomical components of elbow joint. First one is articular capsule. The anterior part of the articular capsule covers the anterior part of the elbow joint. From the radial and coronoid fossa of the humerus to the coronoid process of ulna and angular ligament of radius. Whereas the posterior part extends from the capitulum, oleocranial fossa, lateral epicondyle of humerus to the angular ligament of radius, oleocranial of ulna and ulna posterior to radial notch. Articular capsule is nothing but a covering or envelope around the capsule. Anteriorly what part it covers and posteriorly from where it extends is given here. The next is ulnar collateral ligament. Thick triangular ligament extends from the medial epicondyle of the humerus to the coronoid process and oleocranium of ulna. Part of this ligament deepens the socket for trachea of the humerus. The next is radial collateral ligament. It extends from the lateral epicondyle of the humerus. Ulnar collateral ligament extends from medial epicondyle, whereas the radial collateral ligament extends from the lateral epicondyle of the humerus to the angular ligament of the radius and radial notch of ulna. The next is angular ligament of radius. Strong band that encircles the head of the radius. Angular ligament of radius is the strong band that encircles the head of the radius. It holds the head of the radius in the radial notch of the ulna. Now here you can see this is humerus and this is the angular ligament of the radius. Angular ligament of the radius, it holds the head of the radius, the radial notch of ulna. The next is articular capsule. Here you can see this is the articular capsule and this is the articular capsule. Next, these two are the ulnar collateral ligaments. And this is the oleocranial bursa, the blue color one. And this is the interosseous membrane which joins the shafts of two bones, radius and ulna. Now coming to the movements of joint. Elbow joint can perform flexion and extension. What is flexion? Decrease in the angle between articulating bone, usually in sagittal plane. Extension is increase in the angle between articulating bone, usually in the sagittal plane. So the movements that are performed by elbow joint are flexion and extension. And it is a hinge joint. Thank you for watching. Please subscribe for further videos on anatomy and physiology.